5 minutes. I was recently reading some material from Milton Friedman, and he said, you know, he would like to privatize everything, but the government has to do some things. The only problem with the government is it costs twice as much to do it. And that seems to be the dilemma we have in healthcare. Mr. Gilfin, employee participation in direct contracting programs is associated with a reduction in healthcare costs, improved health outcomes, and increased productivity. Can you share some of the quality metrics that may be used to measure healthcare volume and cost and the improvements you've seen in patient care?
Thank you, Mr. Chairman. Direct contracting can help shift the focus from volume to value. Employers and providers measure success through outcomes, access, and patient experience metrics, as well as through costs. Quality measures typically include improved utilization of preventive screenings, chronic disease management, reductions in ER visits, hospital admissions and readmissions, medication adherence, patient-reported outcomes, and timely access to care. Cost measures focus on total cost of care, including overall spending trends and the substitution of lower-cost interventions rather than potentially avoidable hospitalizations and ER visits. For example, direct primary care has helped improve access and chronic condition management. While traditional primary care wait times might average around 21 days or more, team-based DPC can offer same and next-day access through in-person, virtual, or digital options. That access changes utilization patterns. In DPC arrangements, lower-cost virtual visits account for 15 to 34% of visits, compared with only 4% in a non-DP setting. One member company's direct primary care arrangement near Mesa, Arizona showed 14% reduction in ER utilization. That's not because people who needed to go to the ER didn't go, it's because they were taken care of and they never needed that visit in the first place.
Right. And this improvement in health outcomes, did it help contribute to happier, more productive employees?
Yes, in fact, that MESA program achieved a Net Promoter Score of 88. So that's the score that patients were giving it, 88, whereas they gave most healthcare 58%. So much higher rated. Broader benchmarks show similar results. A company called Hint Health partnered with DPC practices nationwide to measure patient experience. More than 1,500 direct primary care patients across multiple states, they rated it 89%, including a 97% score for contact and access. The study also yielded an NPS score of 85. So in healthcare, that score reflects unusually strong patient trust, satisfaction, and willingness to recommend the care model.
Mr. Newman, in a free market economy, the only way to bring down pricing is competition. And we've heard today about how large employers are able to create savings through direct contracting. What barriers do smaller employers face in entering into similar contracts because they don't really have competing factors in securing their health care? And you have created that, and how does that work?
Yes, thank you for the question. You are right. You know, that we always think of solutions as being for only the large, but in fact, NOMI's core mission is to do it for the small and the mid-size who don't have other options or don't have other paths to access those things. You know, when you think about analytics and payments, it is wildly national, but networks are very, very local, right? It's the town, it's the county, it's the state that you're in. It's actually a level playing field for small and mid-sized employers when they're concentrated in a single area. And these employers are manufacturers, hospitality, restaurants, universities, unions, school districts. And when we unleash their kind of market power in this place, it's a question of how do we make it easy? We need to make it easy for the provider to participate. We need to make it easy for the employer to participate, because guess what? They're all hometown heroes, and they want to help and take care of each other. So, the pure irony when you're talking about price and marketing competition is that the opportunity to save is right in front of us. A price isn't a price in healthcare. $1 of negotiated care isn't $1 to any provider who ever expects to get it for whatever price they list, and an employer's paying $1.20 or $1.30 to even get it. And at the end of the day, when that provider only collects 70 cents on the dollar, We don't have to fight over contracted rates or you name it. Let's pay them what they actually end up receiving at the end of the day, pay them more than that, and make it super easy and simple for any employer of any size to tap into it. And that's the real opportunity. The money's right in front of us.
Good. Thank you very much. And I yield. I am out of time, and now